Good morning, everyone. Today we're going to talk about the lymph-vascular system. So the lymph, it moves throughout the body, between the tissue, and it moves from the body directly to the heart. And it derives from blood and intestinal fluid, which is fluid between the cells of the body. And the idea is to pull out the excess fluid from the tissue and bring it back to the heart. And the graph here kind of help you understand the flow of the heart or flow of the blood right here. This is the lower body, upper body, and where the lymph is connected through or to the capillaries of the blood, where it pulls out the excess fluid, pumps it to the lymph node to be filtered and back after from the lymph node towards the heart. And the component of the lymph node is the lymph fluid, the lymphatics, the vessels, the ducts, and the lymph nodes where the lymph gets filtered, and the lacteals where the vessels you find in capillaries in the intestinal tract. So the collection happens with excess fluid as well, happening from metabolic waste, for example, any microorganisms or invaders of the body that the lymphatic system or the immune system takes care of, then the lymphatic system comes in and cleans up these invaders. Any damaged or dead cells and oversized or toxic protein molecules, the lymphatic system collects all of those to be filtered out of the body. So capillaries are tiny, small vessels. And the walls of the capillaries are endothelial, meaning they're smooth cells or smooth tissue. So there's no muscular contraction or tissue, or muscular tissue in there. And the pathway of the lymphatics closely associated with the veins. They have the same one-way valve pump to push the fluid towards the heart. The only difference here is veins have a smooth and muscular tissue to its vessels, where the lymphatic system is a no-pump system, okay? So only the movement of the body and breathing helps push the lymph and move the lymph throughout the body. Areas where we can find a concentration of lymph nodes. So there's over 400 or 500 or between 500 to 700, depends on the body, of lymph nodes. And they are clustered in different parts of the body. So there is behind or in the back of the head. So behind the ears, around the neck area, the track on the SCMs, under the floor of the jaw, right underneath your chin, and in the upper extremities, kind of a little closer to the lateral chest and underneath the armpit, in the abdomen in the center and around your belly button, and in the a lot concentration is in your pelvis where you have your hip fold, okay? And lower extremities will be behind the knees and on the foot. And the direction is distal to proximal. Okay, now we jump into the immune system, where we're gonna dive in more into how the body kind of fights disease, okay? So the immune system consists of your tonsils and adenoids, the thymus, the lymph nodes that we talked about in the lymphatic system, your spleen, prior patches in the small intestine, the appendix, and the bone marrow. So lymphocytes are white blood cells. T cells are also white blood cells. So throughout this presentation, you're going to hear many different names for white blood cells. But because they're specialized, they have different names because they do a more specific job. Okay, but cytes, we know it's cell and lymph, so lymph cells, okay? So they're specialized white blood cells, and they play a major role in the immune response, okay? Now we know white blood cells originate in the bone marrow. And some of those white blood cells develop to become a type of a T cell. We'll talk about it in a second. Now, lymph vessel transports white blood cells, lymph-carrying microorganisms, which the immune system, attacks those microorganisms, and dead cells. So lymphatic system and the blood vessel, they transport both white blood cells and throughout the body to the site of the infection. And the lymphatic vessels also transport the lymph, carrying the microorganism, and dead cells from the infected area into the lymph node, where they can be digested and eliminated. So your immune cells are lymphocytes, B cells, and T cells. Okay, these three are your main immune cells. Now, the immune cells, they recognize that the cell is not of the body, so they coordinate an attack against the specific microorganisms, okay? So B cells produce antibodies. And T cells, so it's like they're the factory, the B cells. And the T cells, they're responsible to help the B cells to make antibodies for killing damaged, or another word for damage, also different cells within the body. Now, the complexity of the immune system. So the immune system has the ability to recognize a million different enemies, and it recognizes either the bodies or not the bodies, okay? Now, the marvelous thing about the body is it can really distinguish between what it's theirs and what belongs to it and what it's not. Then it produces secretions and recognizes and destroys each one according to its ID, let's say. Every disease or every virus or every chemical has its own ID, its own molecular pattern, and the body recognizes the pattern. And activates whenever a foreign substance enter, and the white blood cells take care of that. Now, autoimmune, on the other hand, you've heard that before. Now, that occurs when the immune system mistakes itself for not itself and attacks itself. So it cannot distinguish or differentiate between if it's its own body or not. So, for example, arthritis, diabetes, osteoarthritis, these are all kind of autoimmune diseases. Also, in some cases, immune system response inappropriate to certain harmless substances like, a pollen, bee pollen, cat hair. Some people have allergies to those. So the result is allergy. And this kind of antigen is called allergen. Okay, let's talk down more about the B cell system. So what a B cell does, it intercepts an antigen, okay? It produces a specific antibody that fits it to disable it and invade it. Now, each B cell is designed to make a specific antibody, and each antibody is also designed to battle a specific microorganism. Now, B cells also developed into plasma cell that manufactures millions of identical kind of antibody molecules, and they pour them into the bloodstream. Okay. Alrighty, so we said whenever antibody or antigen interlock, the antibody matches the antigen and destroys it, and by that, and cleans up the immune system. Now the B cells transform into memory cells that circulate throughout the body, preparing it for the next one. You've heard, like, when you get sick from a disease one time, your body builds immunity to it. So that's the idea. Okay, now the T cell system. So now the T cell coordinates immune defenses. So T cells, they're active against bacterial infection, fungal infection, cancerous cell, wound cell, and any cell that's harboring any pathogen, okay? Now, Lymphokines are a type of protein, okay, produced by the T cell, which draws those macrophages, which is all these different types of white cells, okay, which help activate them. And there are types, there's killer T cell, helper T cell, and suppressor T cell. This is all what's in the book, but it's not going to be too much on that in the exam. After we're done with the presentation, we'll go and dive into questions and you'll kind of understand what they'll ask. So don't get overwhelmed with this. Just kind of get introduced to it. So the killer cells, so they attack the antigen directly, the killer cells. The helper T cell, they enable the other T cells and most B cells to do their work, do their function. They activate the B cells and causing the appropriate ones or the ones that's needed to transform into plasma cell and then flood the bloodstream with the antibodies. Now, HIV, on the other hand, what happens to that? The T cells get destroyed by the HIV virus, which depresses the immune system and pretty much start to suppress the immune system for the individual. Now, suppressor T cell, on the other hand, they monitor and adjust the level between the antibodies and counter the action of the helper T cell. Okay, more white blood cells. All these are white blood. All these names are all white blood cells, okay? Just on a different specialty. So the macrophages and the granulocytes, they remove a neutralized, okay, that means they've been de-armed, antibody antigen and organisms with the phagocytosis, right? Cytosis is a process of eliminating those pathogens, and they're gonna get engulfed and digested. So, yeah. So they're called eater cells. So phagocytes, so it's a Greek name, I believe, okay, and which means eaters. And their function is to gobble up or eat up those foreign bodies, like viruses, pollen, all these kind of things. Now, macrophages is a type of phagocyte, so it's all kind of white cells that migrate to the blood and back into the tissue. And also, remember, macrophages, they get rid of the worn out debris, dead cells, where the lymph node filters it out, okay? Now, mast cells, they are responsible for the recruitment of other inflammatory cells. So maintaining throughout, releasing their content of like inflammatory mediators, like histamine or enzymes and other white blood cells of some sort, okay? And they're also important in allergic disorders. Okay, so how the system works. So the process goes like this. You have an invading microorganism, okay, that the immune system encounters. It releases the right macrocyte, the phagocytes, which produce the chemical messengers. And these chemical messengers are sent to the bone marrow, where the production of the white blood cells increase. Okay, now more macrophages and all the other leukocytes are drawn to that site of invasion. So this is how kind of the body invites other white blood cells to come and do their work. So any antibody present at the site of the infection locks onto the antigen, and the T cells are brought into action, directly killing some of the pathogens and making other more susceptible by attack by phagocytes for an extent. Okay, now debris from this interaction is produced, which attracts the phagocytes and the lymphocytes. And you have the killer T cells that attack the antigen directly, and the T cells begin to produce lymphokines, which is the proteins that attract more white blood cells. All right. which initiate the inflammation response, which is what? Bringing in those white blood cells to the area of infection or inflammation, or where pathogens are present. Okay, now we're going to talk about the types of immunity we have in the body. So there is natural, or there's innate immunity, natural and acquired. So the innate immunity refers to the physiological mechanism we have used by the body and present from birth. Okay. Now the acquired, on the other hand, acquired through an external source. So it could be exposure to a new antigen, which takes usually a few days for the body or for the immune system to develop immunity to it. You have also the memory cells. Whenever T or B cells are activated, some of these cells become memory cells. So next time individual gets sick or encounter an antigen, the immune system is set to stop the infection before it even begins, or through direct vaccination, where the vaccine contain the microorganisms, either dead, weakened, or altered. But it's kind of, you're getting a direct immunity through the injection. Okay, now protection function of the immune system. Understand that fever is a process of the immune system reacting. So it is an abnormal high temperature that the immune system responds if there's like viral or bacterial infection or any major damage. Normal body temperature is 98.6 exactly, or 37 Celsius, and can fluctuate up and down slightly. Now, we talk about fever temperature. At any temperature over 99.8 is considered a fever. So anything by that, even have a few points. Now, a dangerous fever would be about 104 or 40 Celsius. So that requires you going to the hospital. And anything sustained or over the sustained of 104, 107 or 41.6 Celsius or higher can potentially cause brain damage or death. Okay, so it's very important to take care of the temperature. All right. Other signs of fever, you can write those down actually. So the potential dangerous signs of a fever accompanies the person. First, a stiff neck and pain. If you bend or look down slightly, you can feel a headache in your in the sides of your head, or severe headache all over. Also, with these high degrees, you can get vomiting, difficulty breathing, severe swelling of the throat, unusual skin rash, unseen eye sensitivity to bright light. There's mental confusion or extreme stillness or irritability. Some cases, abdominal pain or pain when urinating. Okay. So the treatment is to drink plenty of water and rest and bring that body temperature down. Now, massage is contraindicated, of course, during a fever. So infection so inflammation is an immune system response to local injury or infection. So you want to treat it as any other injury with inflammation, especially if it accompanies heat, pain, swelling, and all these symptoms, or loss of function. So the duration of that would be 24 to 72 hours, which is a day to 3 days. That would be your acute stage. And subacute stage, or the scar tissue formation stage, or the repair stage, there's many names for it, may take, days, weeks, and sometimes months. It depends on the injury, but minimum is going to be over the week. Okay. Now, again, Acute stages of inflammation, when there's swelling, we do not massage, but massage during the subacute, when scar tissue is forming and the tissue are rebuilding, may be invaluable to ensure strong, pliable, and flexible tissue development, because as sometimes scar tissue develops, it can harden the tissue. So massage is great in breaking up any of those tissue. Okay, so the protective function of the immune system is inflammation. Inflammation comes in when an injury happened, vasoconstriction begins and vasodilation follows. So vasoconstriction, constriction of the blood flow first, and then dilation after. Platelets and fibrin begin to form clots to heal the wounds. And all these white blood cells, they come in to do their work, to kill the pathogens, or to bring in more white blood cells. And there's also fibroblasts. We talked about blast always building and class is breaking down. Fiber from fiber. So fibroblast begins building collagen fibers along the wound to create a structure for closing the wound, okay? Dysfunction of the immune system can happen through either a reaction of allergy, okay, which is an overreaction by the immune system to an usually a harmless substance like pollen, pet dander, grass, wherever the allergen is, okay? And usually causes by contact with the substance. And that substance will trigger the production of specific antibodies that causes the immune cells in the mucus lining of the eyes, the airways to release anti-inflammatory substances, including histamine, okay? And symptoms of histamine release, you'll notice redness and swelling of the eyes, sneezing, coughing, difficulty breathing, nasal congestion, hives, and all these symptoms. In severe cases, there's anaphylactic shock, which is a severe reaction, and you need medication for that right away. It's for sensitive individuals and results from a bee sting, food allergy, or, taking any substance that creates an intense reaction in the body. Now, with the autoimmune, on the other hand, we mentioned before, occurs when the body makes antibodies and T cells directly against its own cells, not the cells of the antigen, okay? It mistakes it for the antigen and it attacks us. So no one knows actually what causes immune system issues, but some of them believe it's hereditary, virus, certain drugs, maybe emotional, in my opinion, sometimes, but it's not written here, so I'm letting you know it's my opinion. Yeah. Cancer as well of the immune system, they produce uncontrollably, okay, and they result in a cancer of the immune system, like leukemia, lymphoma, and all these kind of diseases. Immune deficiency disease may be hereditary or virally or viral from a virus, and can result from toxic effect of radiation or drugs. Now, HIV, on the other hand, human immunodeficiency virus, and infects CD4, it's a type of protein, and lymphocytes and white cells. So the body cannot make any antibodies to defend itself properly. So the virus multiplies and kind of takes over the body and kill the helper cells. Now, stages of the infection, so it's a chronic condition, and HIV can be treated, but can't be cured. But medication and the progression of the disease can we can slowly stop it or slow down the progression of it. Some stigmas about the HIV is that if you touch somebody, you can get infected. and that's not true, okay? You have to get direct contact with the fluid of the person. Okay. Now, if a person with HIV maintains healthy for years, now during this year, enough of the immune system remains intact to provide immune surveillance and prevent the infection. Other opportunistic infections here, we have the pneumocystic pneumonia, which is CPC. It's caused by a protozoa and found in the lung. So when the immune system is weakened, as in AIDS, the organism multiplying causes the disease, and it's more common in people with AIDS. Unless you have immune deficiency, there's no concern for this kind of a disease. So it mainly affects the people that have AIDS. Cryptococcal meninges, so this is caused by fungal, infection, which is found in the environment and grows also on pigeon droppings. Dust containing that fungus gets inhaled and it spreads to the meninges, which is the lining of the central nervous system that creates the symptoms of the disease. Coxoplasmosis, on the other hand, comes from a protozoa as well that is usually acquired through eating raw or uncooked meat. So if the immune system is weak, then the infection can spread to the heart, lungs, and brain. So you're more susceptible to what you should be eating. In AIDS patients, the infection often affects the brain, resulting in lesions and neurologic complications, unfortunately. And Candida. Candida is a fungus infection. It's normally found in the intestine, mouth, and the vagina. So when a person persists presence in this illness, it's so persist and reduce because of the illness. Immunosuppressant drugs usually help. So people with AIDS and Candida also can appear in the mouth, what's called thrush, or it can appear as a rash on the mouth. So do not touch any Candida rash because it can be sensitive and also can spread to other parts or to another person. Oh, we got herpes as well. There's 3 forms. There's herpes simplex 1, which just causes blisters or cold sores on the mouth and face. There's herpes simplex 2. This causes painful sores around the genitals and the anal area, and it's sexually transmitted. And the third one is called shingles. And this causes painful blisters that tend to follow specific nerve pathways. So it's kind of all over the body type of a rash. And Kaposki's sarcoma, it's a form of cancer cell that line certain blood vessels and produce lesions that can appear on the skin. They're bluish to reddish, purplish, and can be smooth or raised and can be closed, in which case massaging over them is acceptable. Or they can be open, in which case the same precaution with the blood production must be observed. So you be careful with that. Okay, transmission of HIV only through exchange of body fluid, like you mentioned, containing the virus and conditions necessary for transmission. So proper environment is needed for survival. So the virus is found in the blood, in the semen, vaginal fluid, mother's milk, like that. And it's been found in also sweat, tears, and has not been found in tears or sweat or saliva. So if you kiss somebody with HIV, you're not gonna die. Okay, so sufficient large concentration of the virus must be present to cause the infection. There is no known case of HIV infection caused by contact with anyways, the sweat and the saliva. So don't be afraid.
Can I ask you a question about HIV? Because I know this is a little bit older. And I know people can take medications now where it's like the virus is undetectable. Can they still spread it if it's undetectable?
They
Do you-
still carry it.
Yeah.
So it's still in their body, but it's kind of in remission instead of it being how you
So
say
I'm a little well
active.
versed in this just because of the community that I'm in.
Yeah, go ahead. Can you raise your
Well,
voice?
undetectable is untransmittable. So it's
Thank you.
like
You sure?
I'm positive, yeah.
So you're taking the medication and it
So
stays
as
in
long as
remission?
your viral load is under 20 copies,
Okay.
you can like you could literally cut your arm open and put it to somebody who has HIV's arm and rub the blood together and you still wouldn't get it.
Wow.
Okay, that's good
It's
to
just
know.
yeah, I know, and it's like yeah, this is dated when it comes to that. So
Great.
Robin, that answers your questions. You can't
Okay,
get it,
good. Thank you.
of course.
Great. To know. Well, in the case of herpes, it's not like that. You know, they give you medication. They give medication for that to not have any outbreaks happen. But yeah, maybe it's the same. I'm gonna look into that. Thank you, Tony. Okay, next, let's go ahead and open the workbook and see if you are able to remember certain things and ways. There's a lot of information, but what we really need for the test is maybe minuscule. So let me go ahead and minimize this. And open this. So in your workbook is page 130. So let's try to do the workbook right here without looking to your book and see if you can come up with some answers. If not, then open your book and look into it. All right. So specialized white blood cells called what? That play a major role in the immune system.
Lymphocytes.
Yes, lymphocytes, correct. Now, where do white blood cells originate, or where do you make them? Where they
The
come from?
red bone marrow.
Correct, the bone marrow. Now, white blood cells specialize into T cells. Where does that happen? Where do the white blood cells get mature to become T cells? It's one of the organs of the lymphatic system.
The thyroid?
Close, the thymus. The thymus. Number 4, the agent that triggers an immune response is a or an anything that triggers the body.
Like a
Yes,
pathogen?
close.
Antigen.
Antigen, correct. Nice. Okay. White blood cells are transported throughout the body. So how white blood cells transport or move through what? There's
The
blood
lymph
and
spread through.
lymph, correct. Blood and lymph. Good job. Okay, the production of antibodies is the responsibility of, it's like the factory we talked about, right? We talked about 2 types of cell. One is the responsible for production, one is the helper. So the T cells are the helpers. Helpers for whom?
The B cells.
Correct. Good job. Now, when the immune system mistakenly attacks itself, the result is what?
Autoimmune?
Huh?
Autoimmune disease?
Correct. Number 8, we talked about 3 types of cells, and which one that attacks and destroy the antigen directly? So the type of T cells, there was like 3 types of T cells. It's from their name. Suicide.
Phagocytes?
Phagocytes is white blood cells, and they are two. But to be more exact, they're called killer T cells, okay?
Mhm.
Killer T cells. Okay, now the cell number 9 that is destroyed by the HIV virus in AIDS. So there's the destruction for
Helper cells. Helper.
which cells?
Helper cells? Helper?
Yes, the helper cells. Good job. The T helper cells, correct. The last one, the process of specialized cells engulfing and digesting neutralized antigen and debris is. So after the white cells have came in and done their work, now the scene of the crime is neutralized or the attack or whatever. And now there's debris and metabolic waste that needs to go away. So what is that process called?
Hmm.
It ends with SIS.
That's not what I was going to say immune function, but
That's the,
It's a process. It's like metabolism, right? It's the process. This one is called?
is it phagocytosis?
Correct. Correctamundo.
How do you spell that?
P
Is that
H A G as in good, O, site for CYT, and OSIS for the condition.
Got it. Thank you.
All right, beautiful. So we have next no, we can do this together, and the questions, I'll give you time to do them yourselves, okay? So match the best description when it comes to the types of immunity and disease and allergen and what describes them best. So we have 3, 6, 7, 8. We have 5, 6, 7, 8. Okay. Do you want to do them together, or you want to take a moment to put them together?
You can take.
Yeah, let's do them ourselves for a moment.
Okay, good. Let me stop the recording right here because no need for it. And then I'll give you time to do both pages. So one moment, please.